Good morning. My name is Paula Atkinson and I'm a nurse administrator with Brackenridge Hospital, a part of the Seton Network. And I want to thank you all for the opportunity to present to you this morning my proposal for a pressure ulcer prevention program. I believe we provide excellent care here at Seton, but I also believe we can always do better. I've provided you each with a copy of my presentation to follow along and make notes if you'd like. On the next slide you'll see the Seton Nursing Mission Statement. I believe this mission statement is what we all want for our organization. The Pressure Ulcer Prevention Program, I believe, aligns perfectly with this mission as it will help us to ensure the highest quality of patient care and improve our outcomes while promoting innovation and leadership within our organization. The objectives for our meeting this morning is for me to introduce to you the proposed Pressure Ulcer Prevention Program, to give you a bit of a review of our pressure ulcer prevalence within our organization and within the U.S. at large, to discuss with you the benefits of such a program, to also go over a couple of examples of success stories from out in the field at other organizations that have implemented similar programs, and to discuss what will be involved in the implementation of this program. I will also provide you with a cost analysis for the program and discuss how we plan to measure our outcomes. And I would also like to ask that you please reserve your questions for the end of the presentation. In the next slide, I've provided you with a couple of definitions of a pressure ulcer, just to be clear about what we're discussing here today. In the U.S. alone, there is an estimated 2.5 million patients that develop pressure ulcers each year. Nearly 60,000 patients die from complications related to hospital-acquired pressure ulcers. And this gives us an annual estimated cost of $11 billion a year in the U.S. The average length of stay of a patient with a hospital-acquired pressure ulcer complication is 13 days. In 2007, the Federal Center for Medicaid and Medicare confirmed that they would no longer reimburse organizations for stage 3 and 4 hospital-acquired pressure ulcers. From a financial perspective, it is a critical need to develop and employ an effective pressure ulcer prevention program. In the next slide, you'll see a chart that depicts the Seton family of hospitals' pressure ulcer prevalence between January 2006 and September of 2010. We have made some significant progress, as you can see, but the ultimate goal is zero prevalence, and we're not there yet. The benefits of a pressure ulcer prevention program are, of course, overall better preventative patient care, first and foremost. We also want to save money, and by reducing the prevalence of pressure ulcers within the Seton network, we can save us tens of thousands, or more likely, hundreds of thousands of dollars each year. In just one of the larger facilities, we could save anywhere from the millions. Saving money in one area can lead to reallocation of funds in such areas as hiring additional staff and purchasing needed equipment. So who benefits from pressure ulcer prevention? The patients, of course, as well as clinical staff and the organization as a whole. One success story I'd like to share with you of pressure ulcer prevention program was at the Order of St. Francis Medical Center in Illinois. They started the Save Our Skin program. OSF expanded the use of their pressure ulcer static air mattresses to all adult care areas. They also defined the role of the nurse manager as the process owner and identified skin champions for each unit. Additionally, they provided each clinician interacting with the patient 1 hour of pressure ulcer prevention education. Through these implementation interventions, they reduced hospital-acquired pressure ulcer incidents from 9.4% in 2001 to 1.5% in 2006. And then by 2009, their incidence was down to 0.6. They've been able to save $3 million annually with reduced needs to treat pressure ulcers. Another organization is the Methodist Medical Center of Illinois. This hospital-acquired pressure ulcer prevalence fell from 12% to 4% from 2004 to 2005. But this organization did not see steady results because in August of 2007, they had seen their prevalence rate go up to 9.5, and this was due to inadequate coverage of certified wound ostomy nurses, and they also were able to identify the need for re-education of staff due to improper staging of wounds and wound care interventions. After the hospital added additional wound care certified nurse hours and mandatory education sessions for staff, by February 2008, the hospital had already seen a prevalence rate fall from 9.5 to 4.2. And to continue the momentum, they implemented the Reaching the Moon campaign, where they were able to provide units with acknowledgement and reward for zero prevalence. And then by 2008, they had received their zero status. Our vision for pressure ulcer prevention is that the program is able to help us reach our goal of zero pressure ulcer prevalence through the utilization of evidence-based assessment and intervention measures and increased pressure ulcer awareness throughout our organization. To implement this program, we need your support. The board and organizational leadership endorsement is essential to this program to show their commitment of support for this practice change and to ensure sustainability. The plan is to pilot the program in one hospital on 3 units, 2 critical care units and 1 acute care. And this is to allow us an opportunity to test the program on a smaller scale and implement any changes prior to rolling the hospital out to the whole system. We will then identify a skin care champion. These will be selected to support this initiative for each unit involved in the pilot. We will employ evidence-based practice assessments and intervention tools for consistency in all patient care, and auditing reports will pull documentation from to monitor progress. We will start with a baseline prior to implementing the program to assess prevalence, then reassess at the end of each month for progress. Prevention strategies will be targeted to avoid unnecessary costs. Today, an average cost for treating just one pressure ulcer for one patient is anywhere from $5,000 to $25,000. The program I'm proposing that we implement is the Canadian Association of Wound Care program, which costs an average of $5,000 a year. Additionally, there would be a cost of 1 hour of pressure ulcer prevention education for each staff person that is interacting with the patient. Some of these staff people will be able to take this course during their day of work, which will also eliminate some of the cost. So which makes more sense? Taking the necessary measures to prevent pressure ulcers, or assuming the cost and extended length of stay to treat hospital-acquired pressure ulcers once they've occurred? How we plan to measure our success is by starting with a baseline prior to implementing the program. We will perform ongoing audits and report back to the board quarterly or as often as the board deems necessary. Before we leave this meeting, I am hoping to be able to obtain at least a verbal commitment from each of you that you will review the information I have provided you. We will not be able to begin this program until we have written agreement of the support of the board and leadership. Once we have that, we will begin the process of identifying the most appropriate units to pilot the program on, and the board will receive quarterly updates on our progress. And this concludes my presentation. I can address any questions you have now. Thank you for your time.